Okay, my name is Veronica Rhodes.
How old are you?
I'm 63.
Okay, all right, 63 good years. Now, why did you come here? What was did you have a diagnosis?
Yes, I had a diagnosis of fibromyalgia, of arthritis, of carpal tunnel, I've had gout, I've had, a lot of stuff that all causes pain.
And one of the biggest symptoms in your case for fibromyalgia was fatigue.
Oh yeah, really fatigued. Arms and legs and head felt like lead bone I call it, and just didn't have the strength to get up and do anything. And I've never had that in my life. I've always been active.
Because you've been a woman that has gone, you've been all over the world, haven't you?
Yeah.
I mean, what was it, the archaeology or what?
Archaeology, paleontology, and environmental studies. I worked with students, I took them to research centers where they worked with the scientists.
But the tiredness was so severe that it was difficult to get out of bed some mornings, or?
Yeah, or I'd sit down in a chair and then I just literally couldn't get up. Yeah. A very strange thing. I didn't like it at all. I mean, it really bothered me to my core, that I couldn't move.
Oh, it just wasn't you. Now, what about the mental status?
Oh, fuzzy, even confused, sort of out of it. And even before I stopped working, I just realized that if I was trying to learn something new and somebody was explaining it to me, it's like shutters would go over my mind. I just couldn't absorb it, and that's scary. I asked my rheumatologist if I was getting Alzheimer's.
He said no?
He said, no, I don't see a sign of it. He says, you've got fibrofog.
Yes, that's a term that we hear very frequently. Now, what did you do? What did they give you? Medication? Did they put you on medicine, or?
Yeah, they put, after trying a few different things with varying, problems, they put me on Cymbalta, and I did feel a lot of benefit from that because I was getting depressed, not actively suicidal, but just, let me lay down and die, and so that helped a lot, and it calmed me down because I was jerking and twitching. And then they also put me on a muscle relaxer, which we had to keep downsizing the dose because it kind of knocked me down. I don't tolerate medicines very well. So I was taking a half a tablet at night, and it got me sleeping, which I hadn't been doing. All this really started, and the rheumatologist told me that it was a post-traumatic stress from when my husband was so sick for so long. And of course I didn't sleep at all then, and I couldn't get back into it.
Well, we've seen that fibro oftentimes starts from emotional or physical or chemical stress. But since you've come here and we've been using the brain-based therapy, exercise with oxygen, and some of the other things that we do, what's happened?
Actually, a lot's happened, and it's minus things in that I'm minus the fatigue. I haven't had that in 3 weeks, and so even though I get tired because my stamina's poor, I couldn't exercise before, so I had no stamina. But I'll work a while and then I'll get tired. But I haven't had the lead bones in a few weeks, and that's been wonderful. I'm not so fuzzy. Not so fuzzy. I still get a little disoriented, but I'm not, just like I'm in a fog.
Yes.
And the pain level has actually gone down. It's gone down to where I can manage it. I'm not taking any pain medication.
Okay. And I guess we've got you on a program, which is a prolonged program, but we're 10, maybe 12 visits into it, something like that, in that ballpark. So we've got a good ways to go.
Yeah.
A lot of other issues that we're going to address. So I see you getting your old life back and then some.
Well, I'm looking forward to it because you promised me.
Yeah. Well, thank you very much, though, for taking time to do this. And
You're
I'm sure that you've encouraged other people that are suffering, that are confused, that are that have all of these fibro issues.
Yeah, it's a horrible thing to live with, because for so long you don't get any kind of empathy from anybody. Nobody can understand why all of a sudden you're not you anymore.
That's right.
Because you can't really put it down to a disease.
It's very complex, and most people don't want to take the time to
Yeah.
unravel the problem. But
Yeah.
thanks again, and we'll talk again in the future.